Welcome to Trulyfit.
Dr. Varma, thank you so much for joining the Trulyfit Podcast. Why don't you give my listeners and audience a little background on who you are and what it is that you do day to day in the health world?
Hey, Steve. Thanks for having me. A real pleasure to talk to you today. So I'm a scientist. My background is I got my PhD at Johns Hopkins doing bioorganic chemistry. And then I started doing microbiome research as a postdoc at UCSF. And then I started this company. And very briefly, I've been studying the microbiome for about 13 years now. It's a super interesting field, around less than 20 years old, so it's really young. But I feel like not only is it an incredibly interesting field to be in, but it's had the fortune of really capturing the attention of the public, right? A lot of people are now aware of what the microbiome is, are curious about it, want to know how they can take care of their own microbiome. And really, that is what our company has done, is develop tools to perturb the microbiome in beneficial ways so that it can lead you to better health.
Yeah, it really is all the rage. It's been everywhere. It's talked about on all the podcasts. It doesn't matter if you're a nutrition expert or if you're someone who's an expert in a completely different area. Now it seems to be that the biome, the gut biome, is interconnected with so many things in the body that we're now discovering. And I think maybe that's why it's intriguing, because it went from nobody ever hearing about it to now it being considered one of the more integral parts of our overall health and wellness. I want to take just one quick step backwards. Doing what you what you studied, do most people go off and start their own companies like you did, or do they just sort of fall into day-to-day scientist kind of activities?
Most people don't. Most people do kind of the science thing, either in academia or in industry. But one of the prime motivations for me was, early on when I was studying the microbiome, it was really amazing to see almost on a monthly basis some new discovery, some new insight coming out. That was amazing. And then, I'd be very excited when I read that, and then I'd wait, for 6 months, a year or more for a follow-up, right? Of okay, so this is a cool insight. How are they going on and making this a technology? And what I realized is not very many people are doing that. And, that's not the function of academia. That's fair. The function of academia is to discover things and to do basic science. But, I was kind of frustrated that, I felt like we were leaving a lot on the table. Not that it wouldn't eventually be picked up, but I just wanted to accelerate the rate of innovation and in particular, accelerate kind of my idea of it, my conception of it.
Most of the information or the products or the discoveries that I read about, again, I could be targeted to me because the community I'm in, has to do with digestion and food, right? And how the gut microbiome works in that way. You kind of went a different route, right? You went the skin care route. Can you discuss the initial discoveries behind how it affects our skin and how it affects acne and things of that nature?
Yeah, so, just like we have a gut microbiome, which I'm sure most of your listeners are aware of, we have a microbiome on our skin, right? And it's pretty normal when you think about it, that we have a skin microbiome, we have a mouth microbiome, we have a gut microbiome, and so on. And, just like there are different kinds of forests, right? There's rainforests, there's plants that grow in the desert. The skin microbiome is different from the gut microbiome. Different organisms live there. The nutrients are different. The environment is different. But the microbiome of the skin actually occupies a similar role to the gut microbiome, which is to say that it is intimately tied to our health. It is chiefly responsible for keeping our skin healthy and preventing our skin from getting sick, such as by the growth of unwanted organisms. But more importantly, it talks to the immune system, right? And so just like, although in our gut, right, digestion takes place, what happens in the gut has far more to do with, our health than just digestion. Which is to say that let me back up. So there are two places in our body where the immune system is built up the most, One is in our gut, and one is under our skin. All right. And so the immune systems are just on the other side of the what we call the gut lumen, where all the bacteria are, where all the food passes through, and they're on the other side, kind of with an ear to the wall, listening in, right? And they're taking the temperature constantly, they're sensing constantly. And one of the reasons is that obviously there's a huge bacterial load in our gut, and you can imagine if that ever infiltrated into our body, that would be a huge problem. We would die very quickly. And so our immune system is kind of buttressing against that. But the other thing is also that our gut microbiome talks to our immune system and kind of sets the thermostat, influences a number of immune processes in our body. And that's really what the immune system is primed to pick up on. And so when you're young, if you don't get exposure to the right consortium of bacteria, you can develop asthma or allergies or sensitivities later in life. And it's the same with the skin, right? Like a lot of people develop sensitive skin, rashes, eczema, etc. And it all has to do with a microbiome imbalance that your immune system is picking up and responding to. It's the same with acne. When our microbiome is in balance, our immune system senses that and is okay with it. When our microbiome goes out of balance, it is something that the immune system doesn't like, and it sends out inflammation to deal with it. And that inflammation is just acne. It's just eczema. It's a number of other things. And so understanding the microbiome's role in disease and health, but more importantly, understanding how balance plays into it, is really important because, 30 years ago, right, you would have said, most people's attitude would be bacteria are bad, right? Clean every surface, bleach everything, sanitize, all things. Now we know that that's not true, that there are good bacteria and bad bacteria, and that there needs to be a certain balance, which is why we eat probiotics and fermented foods and so on. And so my research really has been in terms of uncovering this balance, figuring out, what is driving disease, and then developing tools to kind of address that.
Let me give you a little hypothetical here. And I don't know what the testing is. Let's say you swab somebody's skin and you're able to put it under a microscope or whatever it is. But if you take 100 people and you don't actually get to see the people, so you have no idea if they have acne, if they have skin issues, but you're taking each individual's skin microbiome and you're looking at the individual bacteria, do you have a good sense of who potentially has skin issues just by looking at those, let's say, bacteria and numbers?
Not for all skin issues, but I'll focus on acne, which is, the biggest, it's the number one dermatological condition. Nearly all of us get it. It's a nearly universal experience. For acne, there was a study done in 2016 that looked at people with healthy skin and people with acne, right? And they tried to figure out, are there organisms, are there certain genetic elements that are associated with acne versus health? And they built this algorithm from the sequencing data they got, looking at the bacteria and the genes that are on our skin. And they actually built a predictive engine where they then took, blinded microbiome samples, right? So basically they got samples from people. They weren't told whether this is from a healthy person or an acne person. And I think it was over 80% accuracy, that over 80% of the time they could correctly predict, oh, this is a healthy person, this is an acne person, just based on data of what microbes are on your skin, right? So this gives us a very, very strong sense that just like we're able to do this with sequencing, a very expensive technique, our immune system is sensing this all the time, right? They're pulling in data from our skin and they're like, are you in balance? Are you inflamed? Okay. If you are balanced, no problem. If you're not, then I'll send out inflammation. Now, another very interesting part of this study was that they looked at, healthy skin and acne skin microbiomes. And the biggest difference they found was that there's a particular organism called the phage that kills, and the phage that kills C. acnes, the big sort of 600-pound gorilla in our skin microbiome, the one that causes acne. If those phages are present, they're present far more on healthy skin than on acne skin. Now, phages love to kill and eat bacteria, right? So this particular phage was killing C. acnes, the acne bacteria, and it's only found on healthy skin. So this gives rise to this important, really interesting hypothesis that, we all have annoying friends who have amazing skin, look great, never wash their face, never get acne. Chances are they have these phages on their skin that are, balancing their microbiome, preventing the overgrowth of acne bacteria, and the rest of us who are wondering what we did wrong and are on the straight and narrow can never seem to get ahead of our acne. We don't have the benefit of this organism naturally occurring on our skin. And so a large part of our research has been devoted to this organism, to developing it, to be able to put it in a bottle so that everyone can sort of, in a biotechnological way, repair their microbiome, bring it back to balance.
And forgive my naivety here concerning this, but do the drugs that are currently used, prescription drugs to treat acne, are they working on any of this, or are they typically dealing just with hormones and kind of the internal stuff?
Right. So C. acnes, this one bacteria, has been known to be heavily involved in acne for like 80 years, right? And reflecting that, all anti-acne products are antibacterial, right? So you think of antibiotics, you think of benzoyl peroxide, you think of retinoids, they all have an antibacterial effect. The difference is that antibiotics, benzoyl peroxide, all of these, they kill indiscriminately. They land on your skin and they kill the good bacteria and the acne bacteria. And the result is that they're depleting your skin microbiome. So after regular use, months and months of use, yes, you're killing the bad bacteria, but you're also killing the good garden of good bacteria that keep the balance. So what happens when you go off of it? Because benzoyl peroxide is really harsh. Antibiotics, you can't go out in the sun, there's all these side effects. So you stop using them because they're really harsh and you're seeing an effect. And the next thing that happens is that acne comes back for an overwhelming majority of people. And that is because you've depleted your microbiome. The moment you remove this antibacterial, the bad bacteria grows back even faster than the good bacteria because now you've kind of thinned out your microbiome layer. So that's emerging as something that's really important. And fundamentally, all of these pharmaceutical products that are used for acne, although they try to kill the bacteria, they're not able to do this in a specific and targeted way like phages can do.
That's very interesting. Yeah, and that kind of goes along with my own thesis here, and something you just talked about earlier, is that there's people who don't use anything, but there's the other end of the spectrum. There's people who use nothing but products, right? They have thousands of dollars of skincare regimens, and all day, every day, all they're doing is worrying about their skin. But eventually, I would assume, by putting that much stuff on your skin, you're also doing damage, right? Because you're never giving your natural bacteria a chance to build back up. You're never getting a balance because there's always a taking away and a giving. There's never just a relaxation period. And the whole point is to, like any other drug, prescription or otherwise, is eventually you'd like to get off of this, right? There are no free lunches, so to speak. There's always going to be secondary effects. So you don't want to be using it necessarily for the rest of your life. And I think that's what you're talking about. Your product does differently. But okay, this is another really naive question. Why is it that most people have acne on their face as opposed to elsewhere on their body? Does that also lead to the specifics of the phages and the other skin biome?
Yeah, so it has to do with what bacteria causes acne, right? It's C. acnes, this bacteria that loves, so the main food for C. acnes is sebum, which is an oil that our body produces, right? Now, we have three kinds of skin microbiome, and they're basically different kinds of forests you can think of. They're different ecologies. So you have the oily microbiome, which is called the sebaceous microbiome, and it's only present on our face, our upper chest, and upper back. Incidentally, that's exactly where acne hits, right? And this area of our skin is really the only place where C. acnes is highly dominant. Again, that is because our sebaceous glands, these oil glands, really occur on our face, on our upper chest, and our upper back. Then there's the dry microbiome, which is most of our body, your arms, your legs, your torso. It's all the dry microbiome. It's much more Staphylococcus and Corynebacteria. And then there's the wet microbiome, which is our armpits, our groin region, any place where it's kind of closed and moist. And so, you'll notice that no one ever gets acne on their knee, but that's because the C. acnes doesn't occur there in large enough quantities to cause a problem. And because, a lot of our customers actually have back acne and chest acne, and they say, hey, can you use this product on chest acne? And we say, yeah, you can, because the organism, the cause driving the disease is exactly the same. And we actually have seen some great results from our customer base for that. So it's really about understanding the ecology and figuring out how are you actually solving the problem, right? Because a lot of people think, oh, I have oily skin, the oil's feeding the bacteria. You know what? I'll just dry out my skin. Well, that's a huge problem because your body produces oil on the skin for a reason, right? It has a very important function. It acts as a moisture barrier. It keeps your skin layer smooth and supple. It prevents, early aging, fine lines, and wrinkles. And so what a lot of people do, especially with retinoids and Accutane and stuff, it'll permanently dry out your skin because it kills and reduces the size of sebaceous glands permanently. And so, yeah, you're acne free, but you have to deal with chronically dry skin for the rest of your life. And that's irreversible. And so, yes, you're right. The oily skin is feeding the bacteria, but if you can just kill the bacteria, right, and control it, you don't have to worry about oily skin as much because you're using phages, for example, to control the bacteria. And so it's a much more elegant solution, one that does far less damage, and one that gives excellent results, irrespective of what kind of acne you have.
It seems like the research has come pretty far in a short amount of time, at least from the general public perspective, all we've learned. I imagine there's still research going on, right? People are still doing their due diligence to find the next step. What is your forecasting of the next 5 to 10 years in this particular department of skin microbiome? What are we expected to find out? What would you be surprised about?
So I think that we're going to continue to chip away and probably make huge strides as the tools that we use to examine the microbiome, the skin microbiome especially, are getting better and better, right? So there are some technical challenges with studying the skin microbiome. Unlike the gut microbiome, where there's plenty of bacteria, there's plenty of sample, let's say, to choose from. The skin has a very thin layer of bacteria, and when you try to scrape the bacteria off of your skin, a lot of human cells come out too. So your sample, as such, is contaminated with a lot of human cells who you don't care about. You're trying to get to the bacteria, and there's relatively few bacteria. Well, our ways of kind of sequencing and detecting these bacteria have become more and more sensitive and require less and less material. And so we're getting richer and richer data. And further, just as science progresses with one person making an observation and revealing it, someone else picks up on that and takes that forward. We're continuing to see that, and whether it's acne or eczema or psoriasis, rosacea, there's so many skin conditions that we're pretty sure are driven by bacteria. We don't exactly know how. For acne and eczema, it's pretty clear, it's pretty straightforward, it's been studied for a long time. But I'm actually really excited for more skin microbiome insights to come our way because we have a platform technology in phages which can kill and target very specifically any bacteria. So we're actually waiting for people to make new discoveries and say, oh, this bacteria is responsible for this phenomenon or this effect, right? And if it's undesirable, we can actually sort of cut that off and make that into a product, right? Turn that insight into something that reaches people's hands, that gets in people's hands, reaches their lives, and makes a difference.
Are any of your current discoveries or insights considered controversial? And let me break it down for you. If you were to sit down with a dermatologist, let's say, and you were to explain all this as you're explaining it to me, would at some point your ideas and your ideologies diverge, or do you just have the same, let's call it, you're diagnosing the same thing, but you just have different prescriptions for how to fix it?
It's not controversial. It is a newer technology, right? And so when we talk to dermatologists about this, they fall roughly into two camps. One camp says, Oh, I know that the problem, the pharmaceuticals that I'm prescribing my patients are problematic. They cause a lot of side effects. I know patients struggle with them, and they cause a lot of misery, right? I mean, the side effects are not just redness, dryness, irritation, inflammation. For Accutane, it is birth defects, it is liver damage, it is joint pain, and it is incredibly painfully dry skin. And so, the first camp of dermatologists say, hey, if you have anything and if you have data to support it, and we have, clinical data to really support how our phages make a change in the microbiome. They say, hey, I'll take this with both hands. Then there are others who say, hey, Accutane was approved over 40 years ago. Yeah, it's rough, it's harsh, and people have harsh side effects, but they'll deal with it, and it does work. I mean, it does work. There's no question about it. But they're not willing to try anything new, right? And so it really is a difference between derms who kind of toe the line of the status quo, or who are interested really in new technologies, new innovations, new insights, especially not just because it's a new for the sake of being new, but because it really alleviates a huge pain point for consumers and patients, which is that all acne products have huge side effects, and that cannot be ignored.
What is the problem, or maybe it's not a problem, that companies like yours have where it borders on a supplement and medication, right? And from I guess you would say like a marketing standpoint, and from a legal standpoint, you get into this weird gray area. It's like, do you ever want it to become a medical thing? Do you want to keep it as a supplement? Does somebody come above you, like the FDA, and go, oh, actually, this does work. We're going to grab this from you. How do you deal with all of that?
So, I mean, we kind of faced this decision point pretty early on, and what we decided and what we learned was that the vast majority of people with acne seek relief over the counter, right? A lot of them don't have access to derms, and even if they do, insurance is covering acne medication less and less because they think it's a cosmetic problem. It's not. Among other things, it's a mental health problem. Because, for example, there was a study done in the UK which found that people with acne are 63% higher prone to mental health issues than people without acne. That's nearly 2/3 more. And I don't think it comes as a surprise to anyone, especially people who have acne, but even people who don't, because acne first hits us when we're teenagers, right? We're insecure, we're trying to figure out our place in the world, we're trying to find who our friends are and be liked by them, and then there's this thing that erupts on your face that you can't hide because you have to show your face to everyone, and you're trying to deal with that at a particularly vulnerable time in your life. So I think it's really important, and to your point, there's a huge number of people seeking a remedy for acne that can't or won't be able to go to a doctor. And we wanted to make this product available to as many people as possible. And for that reason, we, strongly sort of followed this over-the-counter path. And it's really been a huge success. A lot of our customers are people who've actually tried everything. They've tried brand A, B, C, all the ones you've heard of. They've gone to the dermatologist, and some have been suffering from acne for 7 years, 10 years or more. And then they find us and they'd say, oh my gosh, finally, this is the first thing that's worked. We run clinical trials. We're going to be releasing the data. It's under embargo because of some patent issues. But our aim is really to freely distribute and share data and to educate people. And so we are going to be in the over-the-counter space. We want this product to be available easily to as many people as possible. And we love to educate people. One of our biggest challenges right now is we're a small company. We just started out, and it's a very crowded market. And just like any company at the beginning in a crowded market finds itself, especially when they're not selling the same stuff in a different bottle, right? We're not like the 99% of other brands that are just putting benzoyl peroxide or whatever in the same bottle and different fragrance, different label. we invented a new technology, and we're trying to educate people about the latest science, and that takes time, but we're willing to be patient, and I just happen to really enjoy the education part of it.
How does the patent process work for something like this? Do you currently have no competitors? Is it can somebody still do the research you're doing, but just not put it into a product, or is it really complicated?
It's a bit complicated because it has to do with the regulatory side of things. But yeah, I mean, this is a naturally occurring organism, as I discussed. It's actually found on healthy skin and not really on acne skin. So that's a very interesting insight. I think that, obviously there are a few companies that we know of that are using phages in skincare, and some are planning to kind of address it more towards acne. But we do have a very strong patent that, once granted, would basically give us exclusive use of this technology in acne. And really, for us, our aim is to kind of make things like benzoyl peroxide obsolete, not because they work or don't work, but because of the huge side effects that they have, right? The fact that they damage your skin microbiome, and that's not okay. It used to be okay because you didn't have any choice, because your choices were one harsh ingredient versus another. But now we've invented something that's not harsh at all, and for the first time it gives people this amazing new option that they never had before.
Yeah, I think it's important to give the consumers more options. Like you said, everyone's body reacts differently to medications. So you have I know people who are on Accutane and were fine. They were on Accutane for a long period of time, never had any issues. I know people who are on Accutane who were a disaster. They had every single possible issue that you could possibly have coming from it, and side effects. So to give people more options, especially options that potentially have less side effects and are a little bit more natural, seems to be the way. And I'm glad that you said it's staying most likely as a supplement and not moving up the ladder as a medication where it's going to be harder for people to get. This has been fantastic information. Let's give my audience and listeners some more information about how they can get your product, where they can maybe reach out to you directly, and any other specific website or social media where they can do their research and their due diligence on your product.
Yeah, absolutely. So we are online at phylabiotics.com. We're Phyla, Phyla, and so we're phylabiotics.com. There you can learn more about our science, our clinicals, and make the choice for yourself. And of course, if you want to buy our product, you can buy it at phylabiotics.com as well. We're on socials at phylabiotics on Twitter, X, I guess it's called now, Instagram, Facebook, TikTok, we're trying to spread the word about this amazing new technology for people who have acne, for parents whose kids have acne and who are disappointed that nothing's really changed since they were kids. People are still using the same stuff that you hated as a teenager. Check us out, and hopefully we can educate you and help you make the best decision for yourself.
I'll have all the links in the description below the podcast. My guest today has been Dr. Yug Varma with Phyla Biotics. Thank you for joining the Trulyfit Podcast.
Thanks, Steve. Appreciate it.